May this year, Amnesty International launched for the first time a global campaign to address maternal mortality. Joining me now to discuss this further is Meghna Abraham. Meghna, thank you very much for joining us.
Thank you.
Now, Amnesty International's campaign, can you just tell me a bit more about that?
The actual campaign is called the Demand Dignity Campaign, and it's a broader campaign. It's focused on poverty and human rights, and it's basically looking to end the human rights violations that drive and deepen poverty. And in the campaign we have 4 thematic areas, and maternal mortality is one of the areas we've chosen. We also have been working for a while now on sexual and reproductive rights. So the campaign is, in fact, I would say, with this heightened focus on poverty and human rights, a chance for us to really look at the interlinkages between poverty, discrimination, lack of healthcare, and a denial of sexual and reproductive rights that women face in their lives.
And so how can this type of human rights approach help reduce maternal mortality?
At the very heart of it is first of all, the concept of access to rights themselves. So who is able to access healthcare and who's not? Now, in international human rights law, governments have an obligation to distribute, even if they have limited health resources, they have an obligation to distribute that equally amongst the population. But in most countries in the world, we find that's not the case. The other issue for us is really an idea of active participation of women themselves. So women being able to control, to have information, to make decisions about their bodies, about their lives, about the kind of healthcare they receive. For instance, one of the issues that we've highlighted is the issue of criminalization of abortion. So without any kinds of exceptions being made for women, and unsafe abortion is one of the leading causes of maternal deaths in the world. So I think the human rights approach brings all 3 dimensions, basically. It focuses the attention on the individual and their active participation in decisions that affect them, access to rights, and most importantly from our perspective, accountability of governments.
And what are some of the challenges in terms of mobilising the health community to realise that this is a human rights issue?
Many health professionals are quite naturally quite consumed with dealing with the reality of what they have to deal with on the ground, which is quite a challenging one when health systems are just not in place, etc. And I think human rights can feel like an additional and completely superfluous discipline, and I don't think people see how it relates to the work that they do. So I think this is one of the biggest challenges, to show people why human rights are actually key if we want to deliver better health systems, because they link very much, they give us a framework for what governments need to do, and they give us a framework for equity, which is essential if we want to end maternal mortality.
In countries where women's rights aren't prioritised, what can we do to ensure that those countries recognise that there is a link between human rights and maternal mortality?
So where I think the gap lies, again, unfortunately, like in many other areas of human rights, is the gap of implementation. So governments have agreed to do this, but they're not doing this. And I think, unfortunately, as in other areas, we need various tools of advocacy, persuasion. I mean, we are not alone in doing this. Many civil society organizations around the world are working on this issue. So I think part of it is coming together in advocacy. But a key issue for us in this campaign is also really putting the attention on women themselves and communities being able to hold governments accountable, to be able to participate in decision making. And I think, honestly, this is where a lot of the root of the change lies, because if women are excluded from decision-making processes around healthcare, if they're never consulted, then I don't think we're going to get much change on this issue.
Well, Meghna, good luck with the campaign, and thank you very much for joining us.
Thank you.